wealthy seniors could be asked to pay more from their own pocket for aged care if the government accepts recommendations from a key task force. Joining us live now is a member of the Aged Care Taskforce. It is Grant Corderoy. Grant, thanks for your time this morning. So richer folks are not going to like this, so why should they have to draw down in their super to pay for more aged care costs?
It's a very good question. At the moment, Australia is very fortunate that our direct care needs, these are our clinical needs, being registered nurses and enrolled nurses, allied health, personal care workers and medication, that's paid by a majority by the taxpayer. In fact, the taxpayer subsidy covers over 94% of those costs for residential aged care and over 95% for home care. That's not going to change. The task force is not recommending any change. There is a means testing arrangement for your direct care needs, but as I said, the majority of those costs are borne by the taxpayer subsidy. It's in the area of everyday living services. That's your food, your cleaning, your laundry, your utilities and your accommodation services. These are the services where the providers are not recouping their costs, and we're losing in excess of, over the last 5 years, up to $5 billion have been lost by what the residents of residential aged care are paying currently and what they're not. And that's
Let me just jump in there, Grant, just so I can get some specifics here. What are you actually recommending people use their own money, their own super for in aged care?
They're using their own money or their own super for their everyday living services, their food, their cleaning, their accommodation, where they're staying in an aged care home.
What would be the costs? Have you got an estimate of what those costs would be?
It's
per person, I should say.
Yeah, for everyday living, it's about $80 a day is required. And for your accommodation, it varies depending on the standard of accommodation and the location. But for an average accommodation, it's about $120 a day. So $200 a day to cover your accommodation and to cover your everyday living services.
Okay, so that's going to stack up over time. So critics have already pointed this out as another example of class war this morning. So why should someone who's worked hard all their lives and paid more than their fair share of taxes be asked to stump up even more for those who don't?
So again, I just repeat, for your normal direct care services, which is the majority of the costs, that's paid for by the taxpayer subsidy, irrespective in the sense of your means. So it's only in those everyday living services, and then when they say stumping up for more, they're paying what the costs are, as you have all your life. So they're not really paying more. The current funding arrangements means they're not paying enough.
So what happens if they don't do this? What happens to the system if they don't pay extra?
Well, if they don't recoup the costs, then, as I said, we've lost over $5 billion over 5 years, and this greatly impacts on the sustainability of the sector and the ability of providers to continue providing standards of accommodation, standards of care, standards of their meals. It will impact that, and we're also not getting no new investment in the sector. So we're getting an ageing population matched by ageing aged care homes, which is, from a long-term perspective, is not what we want.
Okay, what about, and this has been recommended before by the Aged Care Royal Commission, what about a Medicarestyle levy? Why not back that up?
The task force looked at a levy, and the opposition had said that they don't want to see any levy or new taxes, and that was cognizant because it has to have bipartisan support. One of the areas of the levy is if you have an aged care levy, as per se, you have other very important community services being disability, children's services, education. Why wouldn't they have a levy? So we felt that it's probably difficult just to target aged care in its own right. And the other thing about a levy, it means that all taxpayers are paying for elderly, where the task force report is basically saying when you're receiving aged care is the time that you should be paying for the costs outside of that substantial already taxpayer subsidy.
All right, well, the government's going to the drawing board over this one. Would you expect that they back up or they accept all 23 of those recommendations?
We hope. The government's had the report since the 19th of December, and they also had the preliminary recommendations some 2 months before. I personally don't find these recommendations too contentious because, again, your direct care needs are already taxpayer subsidy, and there's going to be no change in those arrangements. So I'll be very hopeful that this does get government support.
So yeah, just the extra stuff, day-to-day stuff, that's where contention might come into play here that you would be expecting.
That's exactly where we're concentrating on, your everyday living expenses, which you paid for all your lives.
All right, Grant, appreciate your time this morning. Thank you. We'll talk to you again soon. There'll be more reaction on that coming out throughout the course of the morning as well.